To look at the latest in the pandemic, as well as the push for greater public health measures at Canada's borders, I'm joined now by Dr. Peter Jüni. He is the Science Director of Ontario's Science Table. That is a group of scientists and public health experts who advise the Ontario government on its COVID-19 response. First of all, Dr. Jüni, thanks for joining us.
Thanks for having me.
Can I start with what has come up today and last night, and that is the Premier's request of the federal government that they do more at Canada's borders, and specifically monitoring, quarantining and testing at international travellers at the land border. In terms of this request of a 3-day hotel quarantine for land crossings, where does that fit in terms of what you're seeing in terms of infection?
Well, look, it's a very difficult situation, and we probably need to learn a lot from other jurisdictions that were successful, in controlling their borders, actually, and knowing that we can't generalize everything from places like Australia, for example, that don't have land borders. The point here is we need to make sure that we keep things under control as comes to new variants of concern or variants that could become concerning once we look closer. We have currently many places in the world that are completely out of control, with India, of course, with the entire Latin America. Tragedy is happening there right now, and we probably in the next few weeks need to find solutions that really make sure that we just can move forward and have border controls reinforced but feasible also for people. And on the other hand, also, are able to take into account the vaccination status of people. This will be far from trivial, but we're right now just moving very rapidly. How can we do something that is actually workable for people, but at the same time really makes sure that people don't undermine quarantine if it's needed, and that we understand that we only just have people released, out of quarantine when the tests are clearly negative, and when we have reassurance that there are no potential new variants actually just entering the country or the province.
Okay. The Prime Minister today, with regards to the specific request by the Premier, his request that this 3-day quarantine hotel be extended to people crossing the border, the land border from Canada-US, the Prime Minister basically said, look, these are people who have already been quarantined for at least 2 weeks in the US. They're people who have already had a PCR negative test in the United States to be able to cross the border. He says he doesn't think the 3-day hotel idea specifically would be of any benefit.
No, we need to really just consider how we handle that. The issue with the 3 days in a hotel is that it can be very challenging for various reasons, including economic reasons as well. Are there any other possibilities? I'm not completely sure how to handle that right now. What I'm sure is we just shouldn't, kick the can down the road. We need to really just make sure that we understand how this can be handled. But vaccination status needs to be, taken into account, and obviously previous test results.
Has the Science Table ever made a recommendation to the Premier or to the government on the issue of border controls and testing at the border?
We certainly have discussed this once or twice at the health coordination table, but I'm sure there weren't any firm recommendations. Okay. It is a complex, challenging topic, actually.
Okay. I want to talk about the larger issue in Ontario, as you know well. The latest modelling came out yesterday. It suggests that Ontario hospitals, which are already at overcapacity and which are shipping patients around the province, that the hospitals still have more dire days to come. Can you speak to that? Is that your reading of the situation?
Yeah, we need to be aware of that. Luckily, we were able to reach the peak in terms of daily case counts, but this doesn't mean anything yet as comes to hospitalizations, hospital occupancy, and especially ICU occupancy. We may now just about approach the maximum for ICU occupancy. If this is the case, this will go for weeks and weeks until we slowly start to see a decrease, and the numbers are really, really precarious. We need to be aware of that. In addition, one of the other challenges is not every single public health unit in the province actually has reacted already. Peel has not reached its peak yet. It flattens now, but we have really tremendously difficult situations.
Some people mentioned that the modeling, and you alluded to it, that the numbers in ICUs, on ventilators, the people in serious medical treatment are not going to go down. Can the system sustain that for people? I mean, doctors are talking about people being in ICU for a month and a half.
It is a real challenge, and you know, we don't have much choice as a system, and you know, and then again, also just keep in mind, I'm not an ICU doc, but what I see, what my colleagues actually are trying to do is really to find the best possible solutions in this situation. You know, I'm glad that we make it probably below an ICU occupancy of 1,000 beds. But we're far away, you know, from you know, just having even a first signal of things getting slightly easier. We perhaps have avoided, you know, the worst of all disasters here, but it's extremely precarious, and this will be challenging. Also, you know, just from a perspective of the staff, people are exhausted, people are burning out, and we don't have all the qualified staff that would be needed, you know, to keep this sustainable. And I know that my colleagues will continue to try as hard as well as they can, but it will be challenging.
Okay, I want to ask you something. This week we had some good news, according to many people, in terms of the paid sick leave announced by the province. Legislation's made its way through Queen's Park quickly. That whether you find it the optimum type of sick leave or not is one question. But again, in the modeling from your science table, you again stress in yesterday's report that the work mobility is still a problem. You see, basically, too many people going to work. You're again repeating your call that Ontario has to redefine the list of essential places of work. Do you think the Ontario government will ever revisit that and ever redefine what is an essential workplace?
Well, I can't give you an answer. Of course, I hope so. First of all, we need to just be very clear. If we talk about paid sick leave, a program that doesn't give essential workers the guarantee that they just can call in and everything is being looked after for the next 2 weeks, will probably not be efficient in contributing to a control of the pandemic. So that's one challenge. The other challenge is, indeed, we just need to make sure that we have this distinction between what is really essential and what is not. Again, remember the situation in Peel. It's extremely precarious there right now. And we would need these sorts of shortlists. I can't possibly give you an answer what the government will do, but we believe these two aspects, the paid sick leave that actually works for people so that they stay home, plus a distinction between essential and non-essential work would be extremely, extremely important.
Okay, I just want to take you up on one thing I think you seem to have suggested. You said paid sick leave will only work if someone can call in and know they can stay home for 2 weeks. This system that's been introduced this week is that you'll have 3 days of provincial sick leave, which you can call in for, but there's still an application to get to the federal leave. Do you think the system will work as you're seeing it?
No. It won't. You know, the proof of concept has been the federal system on its own. It didn't work at all. If you place the administrative burden on people in these situations, you know, it won't work simply. They will not have the guarantee. The money comes too late, you know, in the process. That's for people who actually, you know, have a migration background in many situations. They live really from paycheck to paycheck, and they need a simple situation that works. Otherwise, people simply won't speak up. And, you know, I've just been on a site visit in a meatpacking plant, you know, a few days ago. Looking into what goes on there, if you just see the circumstances, it's completely clear. If somebody doesn't have the opportunity to stay home when they are symptomatic, if the virus is being introduced in such a setting, this will spread like wildfire. So we need to find a solution if we want to control the pandemic. This is about both. It's about supporting those who need it most, but it's also supporting everybody eventually, because it will be much cheaper, much more economic if we can open up slowly and just make sure that people can stay home when they need to.
Okay, Dr. Peter Jüni, I want to thank you very much for taking the time.